Let's start.
Coronavirus or COVID-19 is a new disease. So it is understandable to have the fear and panic among the general public. We have also realized that even amongst the health professionals themselves, they also don't have enough confidence, to deal with this new disease, because most of them are also learning on the job. So what is now needed, in Zimbabwe is for us to make sure that the general public gets correct information through health education, information and awareness campaigns, so that we move away from the current situation where people are relying on social media platforms for them to get information about coronavirus. Unfortunately, there's been a lot of misinformation on those social media platforms. We also need to guard against the stigma and the discrimination. We have already started to see some elements of stigma, especially directed to certain nationalities, and in particular those coming from Asian countries, including China. It is not necessary to blame anyone. This is a global health pandemic, and it is unfortunate that we are seeing stigma and discrimination rearing an ugly head. We don't want the repeat of what we saw at the advent of HIV, when people living with HIV were stigmatized and discriminated. So it is important that especially those in positions of authority, they need to be sensitive on the language which they use, because we then don't want to see stigma and discrimination on COVID-19 degenerating into xenophobic attacks. It would be a tragedy if we allow that to happen. We also welcome the measures that were put in place by the President, working in partnership with the Ministry of Health and the WHO. The travel measures, including measures, banning, public gatherings. But we also feel that those measures should also have been accompanied by mechanisms, to enforce those measures. Because what we continue to see in most urban areas is that a lot of people are still behaving as if it's business as usual. If you look at public transport system, we have seen the subsidized buses, especially the Zupcos and the open trucks, overloading people. We have also seen very long queues of people, waiting to buy the subsidized mealie meal. We have also seen the same in the public markets, and even, at some of the banks, where we continue to see some long queues of people who are not even observing, the social distancing. All these spaces and platforms can be a source of, transmission and spreading of, coronavirus. We also call upon, the local authorities to play their part in terms of making sure that, urban areas you have access, to clean, safe water. Most urban areas at the moment, yes, people may have taps in their homes, but when they open the taps, water doesn't come out. In some cases, some urban areas have gone for weeks, some even months, without, potable water. So when we are encouraging, the general public to wash their hands, unfortunately, they end up looking for alternative sources of water, which may not be safe, which may not be clean. it then defeats the whole purpose of basic health hygiene. Because with coronavirus, we just need to go back to the basics and practice very high levels of basic health hygiene. But for that to happen, people need access to water. I think Zimbabweans should move away from this business as usual that is happening right now. Yes, we know that our economy is highly informalized, and people have to go and do something out there for them to have some sort of income. Yes, everything else is important, but nothing is more important than your health. And this coronavirus, it's a serious disease, and it needs some serious measures to be put in place. Let us also learn from the mistakes of countries such as Italy. I'm sure we have been following the high number of deaths that are happening in Italy, mainly because they did not follow what was supposed to have been done. So all of us as Zimbabweans, we have a role to play to defeat this coronavirus.